Dr. Paul here. I've got a gentleman with something going on his chest that we need to go take a look at. How you doing?
Good.
Good.
I've been seeing a lump here for a couple of years at least, but just in the past week it's starting to hurt and gotten red.
Okay, didn't it used to be red?
Nope, just was there and didn't pay much attention to it.
Okay.
My dad's had the same thing. So.
Huh, alright. That's about 1 centimeter in diameter and looks a little infected. I mean, the fact that it's now red and wasn't before suggests it's infected. Alright, super. I think we'll numb it up.
Yeah.
Okay.
We'll numb it up first so that hopefully what I'm doing won't hurt too much.
Sounds good.
And then initially I think I'll put a needle through, just see if it's got any fluid in it. If I get pus, we'll culture it.
Okay.
And if not, we'll just try to open it up just a teeny bit and see what's going on.
Sounds great.
Alright.
I can't see you, Stan. There you go.
You're doing great? You feeling alright?
Oh yeah.
Alright. We're gonna just go in and put a little numbing medicine. You'll feel a pinch. You felt a pinch, I imagine?
Oh yeah.
Sorry.
Oh no, that was easy.
And then maybe you're feeling a little sting?
A little bit.
So for the viewers, you can see the rising pressure underneath, so you can tell this lidocaine is getting all around. Getting a little pale over here, so that's, I put lidocaine with epi. You okay?
Yeah,
It sting a lot or a little?
just a little.
Okay. My guess is that's going to be enough numbing. Yeah, see the blanching right there? So that's probably going to be plenty. That's less than 1 ml. Subcutaneous epinephrine. Yeah, now I can see it's totally blanched. Alright, that was the hard part. You did good. Just going to, you feel that? Good. Alright, so you didn't feel that, that's good, you're numb. We're going to use a number 11 blade because it's got the sharp tip. We'll just go in with a sharp little blade. Open that up. Now,
Do you feel anything when you did that?
Nothing.
alright, so yeah, you can see this, a little bit of pus on the end of that swab. So it's definitely got some pus. That's plenty for culture purposes, and I'm going to just squeeze out the rest. So we're just going to push out that pus. Does that feel alright?
Great.
Okay. So I'm going to just wipe that excess pus off. Give it a little bit more. I think it's been stuck there. Like you said, you've had this for a long, long time.
At least a year.
One last little wipe and we're good.
Sounds good.
We got most of that stuff out of there. We're going to use a Band-Aid. Wow, that's high tech.
You survived, man. How you feeling?
Great. Major surgery in the doctor's office. I love it.
So folks, what I think we have is an old abscess that got reinfected and is currently infected. You saw the redness, you saw the pus come out. So we're going to treat this with an antibiotic. We've got a culture pending, so we will know exactly what organism we're dealing with and what antibiotics it's sensitive or resistant to, and make changes if necessary based on those results. So some folks are real worried about antibiotics, and it's not a bad thing to worry about because antibiotics do tend to also destroy some of our good bacteria, what we call our microbiome, the good bacteria in our gut, GI tract. So it's often a good idea to take probiotics. These are the good bacteria during and especially after you have an antibiotic. So we'll talk a little bit more about that. We've got some options for you. And you can also get natural fermented foods for those of you who may not want to go out and buy something as far as a pharmaceutical or a supplement. Anything that's fermented, so yogurt, kefir, kimchi, you name it, fermented anything works great to replace the microbiome.
We want to take care of your microbiome.
So if it keeps coming back, it's always in the midline. Eventually we might have you see a surgeon and they do some stuff in there to get rid of it.
Great.
All right, man. Thanks.
All right, thank
you have
you.
any advice for your fans?
See him if you got to do something, 'cause he was good.
Well, there you have it, folks. I didn't even pay him to say that.
No, not too much at least.
Yeah. Thanks for watching. I'm Dr. Paul.